Hi, I'm William Omenyo from Sodeka PHM Kenya. I'm glad to have attended this year's IPHU. It's a training worth going. We've learned so much in terms of health activism. We've interacted so much with other countries, how they do their activism, how they implement their UHCs. So we've done a lot of learning, we've got a lot of knowledge, and we appreciate for the organizers of this IPHU. They may continue actually organizing more IPHUs.
Hi everyone, I am Davis Elijah Mayorio from PHM Uganda chapter. It has been a delightful experience attending the IPHU in Nairobi, Kenya 2023. And my biggest benefit from attending this IPHU training is that I have been able to have an in-depth and vivid interaction with country circles from the East and Southern Africa PHM circle, and I've also been able to learn and share knowledge with resourceful facilitators in the PHM Africa circle.
My name is Charles Okwemba, Head of State Commendation. I'm so privileged to have attended this meeting, and I believe health is everything to a human being, and we are looking forward to do advocacy so that every person will understand the power of health. We thank you, the organizers, and we believe we shall continue advocating for the health of our people, and I believe the rural communities shall have to benefit out of this. We lift you, and we know that we are going far. We thank you for listening to us. Thank you.
My name is Manirakiza Ruvugo from Burundi. I came here for the International People's Health University to be trained on the activism. So what I took from the course is that we needed to be ambassadors of the People's Health Movement so that we can work together so that the health for all is established in every communities. So I thank the organizers and everything, the partners, members, and co-participants for this insightful session. Thank you.
Hi everyone, my name is Liwakala. I come from Zambia, PHM, a member of this International People's Health University here in Nairobi, Kenya. I must thank the organizers for having invited me to come here, because this workshop has opened up a number of things that I didn't know. I didn't really get the correlation between universal health coverage and care coupled with primary health care and the concept about all these things. But now I understand that I'm able to blend all these, and from here I'll be a better ambassador to those that are struggling for health, so that there is really universal access to health by all. Thank you so much.
Hello everyone, my name is Wale Natasha, one of the participants of the International People's Health Movement 2023 hosted here in Nairobi, Kenya. One of my biggest takeaways was when we learned about the policy and research. I really feel like the health industry we really need to invest more in research and getting to know more about the policies. Thank you.
Everyone, my name is Senzeni Banda from PHM Zambia, and I attended the International People's Health University here in Kenya, Nairobi 2023. What I loved about the workshop was seeing how different countries apply their universal health coverage, and I saw that most countries have literally the same problems. So now it's up to us to take whatever we are learning here into our communities and apply it so that we can have better health in our countries.
Hello everyone, my name is Evans Wamiru from Kenya. I'm happy to be part of the people who are here to learn from about health, organized by the PHM movement. It's been a 1 week of great learning and great insights from different people from different countries in Africa. And it was wonderful to see how Africans discuss African solutions to African health problems. So one of the interesting things I've found was that I've actually realized is how things such as intellectual property rights, especially patents, can be a huge hindrance to the right to health and universal health care.
So other than that, it's been a great thing, and thank you to the PHM movement for organizing this.
Hello everyone, how are you? My name is Rumbizai Chiza, all the way from Zimbabwe, the Teapot Nation. I'm here in Nairobi, Kenya 2023 on the IPHU 2023 learning engagement. And one of the things that I've got to learn today and in the past 4 days here is on women and gender equality and intersectionality to health, which is one of the key things that I work with back at home. And I'm happy that you know, we are here as activists, grassroots health activists, and we're learning all those things. Hopefully, as we go into 2024, we'll be able to implement everything that we have learned and make sure that we all make gender equality and access to health for all a reality in Africa.
Hello everyone, my name is Motepile Mutiki from Lesotho, and I came here in Nairobi for International People's Health University of the PHM People's Health Movement. And one of the things that I have learned throughout my entire stay here is the PPPs. Yeah, that's right. And I've learned that Queen Mama Hat Memorial Hospital in Lesotho back at home is one of the first African initiatives towards that initiative of the PPPs. Thank you.
Good day everyone, my name is Tanduwe Chaka from South Africa. I came here to Kenya to learn in International People Health University. I learned many things here. So one of the things that I have learned is about UHN, NHI, the implementation, and I really gonna implement some more things that I have learned here. Thank you.
Hello, my name is Bert. I am from South Africa. I am an academic by training, and when I came here I said I am a closet activist, and I wasn't exactly sure what to expect from this week. But what I've learned is that as Africans, we have representation of more than 9 countries at this meeting, is that we all face the same problems and the same issues, and I think that if we can stand together, we can really make a difference. And what I've learned this week is that the political economy of health is really an issue that we need to take on. And I was also very interested in universal health coverage, especially as South Africa is moving towards that. So I learned a lot from this week. Thank you.
My name is Ivoni Carter from Malawi. I've come to learn IPHU here in Kenya. I've learned a lot of things. I've gained a lot of knowledge and skills. When I go home, I make sure that I will make my advocacy well increased, because I will make sure that all people will be included in everything. For example, people who have been left behind, people with disabilities in Malawi, they don't know how they are rights, but I will make sure to advocate for them to have access in health services in all. Thank you.
This has been a beautiful week. We are here for IPHU, which is covering the 9 countries in Africa. And as a facilitator, I want to say that we are happy with what we've seen happening at the grassroots as we celebrate this period of 16 days of gender activism. The main component that I was facilitating on is related to gender, health, and intersectionality. And this was a matter that the participants dived deep and brought out the issues they are addressing on GBV in Africa. We will continue to fight for GBV in Africa.
Molweni, that's hello in isiXhosa. I am Zimbini Madikiza from South Africa. I work for a rural health advocacy project. Attending the IPHU enlightened me more on the need of strengthening community capacity in terms of advocacy skills, so that they are able to advocate for themselves, for a creation of a supportive environment coupled with the behavioral change initiatives. As we are celebrating 16 days of activism and World AIDS Day today, we are learning from the successes of the previous activist struggles that are there, putting them into case studies of how did they attain better access to things like your ARVs and medication. So the importance of community engagement stands as an anchor of achieving universal health coverage. We need empowered communities, we need enabled communities, and advocacy.
Ujambo. Hello, namaskar. I'm Ravi Ram from the People's Health Movement in Kenya, and I'm speaking to you from the International People's Health University for East and Southern Africa, which coincides with 16 days of activism to prevent and end violence against women. We have activists, about 50 activists from 9 countries in the East and Southern Africa region, and all of us are committed to incorporating gender equity into equitable health systems. You'll see our work. Thank you.
Hello everyone, my name is Carol Esther Nabanja and I'm coming from Uganda, that's the Pearl of Africa. I'm here at the International People's Health University in Nairobi, attending the health advocacy course. One of the things that I've picked from this course is I have to be an advocate. I have to represent my community when I go back. And one of the actually strong points I'm looking at is health education at a lower level. We realize in our health education systems, we do not have something like a life class. At least we should have a life class so that when a person leaves a certain level of education, there are things that we embed in them. And in this life class, we can be able to pass on health education messages, because we as activists, we need to ensure there is behavior change, and this can start from those very life classes, capture people at an early age because they are more receptive and can easily change compared to other ages. Thank you.
Kwa majina naitwa Beatrice Mushi. Nimekuja hapa Nairobi kuhudhuria mafunzo ya IPHU 2023 nikiwa ni mwakilishi wa PHM Tanzania, lakini pia imeangukia katika siku 16 za harakati za kupambania haki za wanawake na harakati pia za kuleta elimu juu ya masuala mazima ya HIV na ukimwi na masuala mazima ya afya. Nimejifunza mengi katika kipindi hiki na ninawakaribisha wengi zaidi kujiunga nasi katika harakati hizi. Asante.
My name is Wilson Damian Asip and I'm from People's Health Movement Malawi. One thing that I've learned from this IPHU is an issue of how decisions of few people can affect health of so many people, the political economy of health. What we are saying is we must give the power to those that are most affected to make those decisions. But also today, we are looking at 16 days of activism against gender violence and many other disparities that are there. Thank you.
Penina Hissa, I'm based in Nairobi, Kenya. This year on 16 days of activism, we are calling upon everyone to stand up, speak up. Gender-based violence is a public health issue.